Hi, my name is Christine Dean, and this is my physical activity log. Let's get started with some CDC guidelines. Adults should be exercising at least 150 minutes every week. That could be 30-minute walks 5 times a week, moderate activity, vigorous muscle strengthening, also known as resistance training. Just meet that 150 minutes and you should be good. The more, the better. Children have a different guideline, but I'm not going to dive too deep because I follow the adult guidelines. So as we get into the impact that physical activity has on diseases, it could be used as a prevention measure or a treatment. And as you can see right here, it decreases the chances of getting chronic diseases such as diabetes, coronary heart disease, congestive heart failure, cancer, obesity, metabolic syndrome, so much more. With that being said, it assists in decreasing risk factors such as obesity, high cholesterol, hypertension, many other things that correlate with these diseases. Of course, the more you move, stronger your bones, healthier your muscle, so on, makes it a lot easier to participate in everyday life activities. With that being said, elderly, huge. If you're active throughout your youth, it's going to make it a lot easier when you're older and you have to worry about those slips and falls and recovering from them. Helps prevent injury because you have that stronger muscle, healthier bone. Harder to hurt yourself that way. So improves overall health. Okay, let's move on to my moderate aerobic physical activity data. Week 6, as you could see, was the longest period of time that I had this exercise. Week 4, I put in more of an effort because that was Thanksgiving week. I wanted to make sure I could eat that extra slice of pie if I wanted to. But as you see across the board, here's 150 minutes. I exceeded and actually did more than 150 minutes alone with just moderate aerobic physical activity, which of course is paired with other activity throughout the week. As you see here, vigorous activity, that wasn't so much a thing. Week 4, I was in Tahoe with my parents, and I went skiing with my dad. I snowboarded, so I went snowboarding that week. And then with strength training, I initially went into this thinking that it was all about lifting weights and all that stuff. No, yoga, which I did, yoga and stretching count as strength training. You're just using your own body weight. So this alone would have not met CDC guidelines, but of course this was paired with my moderate aerobic activity along with that 1 week of vigorous training that I did. So like I said, exceeded CDC guidelines. Right here is broken down to the 3 exercises I did the most. Walking took a majority of it. That's because I have an older dog. She can't go running, so we walk, and we do about 30-minute walks twice a day. Busier days, I cut it down to 15 minutes. That little sliver of snowboarding, which that will definitely become bigger over winter break because I plan on spending more time in Tahoe to snowboard. Here's my yoga / stretching. And then as we move on, let's talk about the physical activity, lowering my personal risk for diseases. So right now, a huge one, COVID-19. As you work out, you're lowering your risk for diabetes, high cholesterol, so on. And with that being said, you have a stronger immune system. You have a stronger immune system, it makes it easier to fight off that nasty virus, making it easier to recover in the end. Another big one, not in my immediate family, but in my extended family, there's obesity. Obesity with exercise lowers any health risk associated with it, which could be, of course, cholesterol, hypertension, your glucose intake, just all that little stuff. Exercise could help lower. Another big one, diabetes. That's huge, huge, both sides of my family. So I'm doomed to get it. But combined with diet and exercise, it could decrease my fasting glucose, which in the end will help me lose weight. I don't need to lose weight, but it could lead to a preventative measure of type 2 diabetes. Now, exercise alone, I'm not too sure how well that would work out. It does make a change, but is it enough to keep you away from type 2 diabetes? That depends on your body, your family history, and so on. Another big one, congestive heart failure, that runs very strong in my family. With exercise, they focus on continuous and strength training. They found that it could improve the overall health quality of life, um, prevent any hospitalizations, stuff like that. However, they also said any form of exercise is beneficial. It may not be as beneficial as continuous and strength training, but it is still beneficial. So though I focused on those ones just because I could relate to those. But of course, there's many other ones with information, and sources are all correlated with these little numbers when you look at the end of my slides. My current exercise regimen, I think I'm doing the bare minimum to prevent these future diseases that I'm scared of getting. So I would like to do more. I'd like to do more than my walking of moderate aerobic exercise. I believe I should do more vigorous training because I lacked in that. As you see right here, I want to implement physical activity in my life by broadening my types of exercise, by doing more vigorous activity. I think it's extremely important to educate your children on this and your family and friends, because I don't think anyone educated my parents about this, so they didn't educate me about it growing up. Um, so I think that's extremely important. Here's all my references. They're correlated with the numbers on the slides. And that's it. Thank you for listening, and I hope you learned something from this.